Hello, everybody, and welcome to the syllabus overview for EDE 466, Problem Identification and Intervention in Counseling 1. This is my favorite course to teach. I just think that it is so interesting. I love the DSM. I love the process of diagnosis and treatment and seeing people get better. And so this is a really great course, and I'm glad to have you here with us. So I'm going to go over the syllabus, and then if you have any questions or if there's anything you need, please reach out. Text is best, and I'll be happy to get right back to you. So this course is 3 credits. It is asynchronous. The difference between this course and pre-practicum is that we will have a Zoom meeting before your first case conceptualization is due. So we're going to do that first case conceptualization together. So everybody gets an A, yay. But I want to show you guys exactly how to do it. So I'm going to send out in the announcement today, in your welcome back to class announcement, I'll send out a date and time and link for that Zoom meeting as well. We can also have other Zoom meetings during this course. If that's something that you guys want, just let me know and we can pick a day and time and all come together. This course has a lot of content in it. It's not pre-practicum, is kind of like the nuts and bolts and how you start to know clients and write about treatment plans, and like it starts with knowing yourself. And so a lot of the assignments are like that. This is very content heavy, and diagnosis is something that's really important to an LMHC. We now have diagnostic privilege, which is something that we'll talk about as we move through the course. And so, it's not something that should be taken lightly. Diagnoses go into people's medical files. It follows them forever and ever. So it's definitely not something that I take lightly. And the way that I teach the course is to understand that there's a lot of responsibility that comes with providing a diagnosis. It's not like you go to the doctor and you say, my throat hurts, and they swab your throat and they say, yep, it's positive for strep, right? There's no blood test for anxiety. There's no blood test for depression. So it's really your clinical judgment in conjunction with assessments and with the DSM, and forming this relationship with your clients that allows you to provide the best diagnosis that you can as their mental health provider. So that's what we're going to talk through in this course. So here are our course objectives. Again, everything is aligned with CACREP. CACREP does not accredit bridge programs, but everything is aligned with CACREP in here. So you're going to learn about clinical and theory-based models of normalcy and psychopathology. So the first 2 weeks of the course, the first actually 4 modules of the course, or I'm sorry, 4 weeks, 2 modules of the course are really about the history of the DSM, where it came from, diagnostic treatment procedures and services, what does even psychopathology mean? And then in the 3rd module, we start getting into each one of these psychological disorders and how to identify what is going on with a person. So the first 4 weeks is really just getting your feet wet with the DSM and helping you to understand where all this comes from. And then we'll go into the case conceptualizations and case study work. So you'll become familiar with the basic criteria of major diagnostic categories. We'll look a lot at the DSM-5 TR terminology, structure, assumptions. It's not a perfect science, that's for sure. It's definitely very heavy in the medical model, and some of you might not ascribe to that model. But the licensing exam for New York State does ascribe to that model. So it's definitely a balance, and we'll talk that through as well. You're going to really learn about the notion of continuum of care and what that looks like. You're going to look at the diagnostic process. You're going to look at symptoms through a clinical lens diagnostically. Then we'll review alternative diagnostic models and tools to the DSM-5, including computer application programs and diagnosis and assessment. So the world is definitely changing with that. The way that we are able to do things like take notes for clients or provide assessments for clients, that has changed as well. So we'll talk about all of those great things. We'll really talk about intakes in this course. So a client comes to you, you are given, with a certain presentation, and it's up to you in that first 45 minutes, if you're working through insurance, to figure out what the heck is going on. So how do you use an intake to come up with a provisional diagnosis? And then how do you work through that as you work through treatment? This is not a treatment plan course. This is a diagnostic course. However, we will talk about treatment strategies for each one of the conditions that we talk about. And then through each module, we do touch on psychopharmacology and which medications are appropriate for which diagnostic conditions. So that is woven into the entirety of the class. So the outline for problem ID 1 is abnormal behavior in a historical context and clinical assessment and diagnoses. So your first 4 weeks is really diving in and learning about those two things. And then week 3, we start with neurodevelopmental disorders. We go through disruptive impulse control and conduct disorders, anxiety disorders, and depressive disorders. We also talk about trauma and post-traumatic stress disorder. So that's kind of the first half, if you will, of the DSM. And then when you move on to problem ID 2, you'll get into those other more complex, I think, disorders. So attendance policy, again, it doesn't really apply to us. Just make sure you have 2 weeks to finish all the work in each module, because it is content heavy. I do give you more time. When we have a Zoom, the first Zoom is mandatory. You all have to be there. I want to make sure you know how to do a case conceptualization and how to, document it appropriately, and we can work through any questions that you have. And then any Zooms after that will be up to you if you want to attend or not. If you feel like you need to, then please hop on. If you feel like you got it and you're doing great, then that's okay as well. Your required text, you need the DSM-5 TR, same text that you need for pre-prac, same text that you'll need for the duration of this program. So that's the one that I would purchase. Psychopathology from science to clinical practice. This is a big old textbook. It's a good one though. I definitely wanted to get one that's practical and easy to read and will give you a lot of information. You can access it on the U of R library, or you can purchase it, whatever is easiest for you. The Clinical Handbook of Psychological Disorders in Children and Adolescents, a step-by-step manual. That will be on U of R library as well. I would purchase it, especially you guys that are in schools now. If you're hoping to continue your work with kids, you really want something that is going to hone in on the specialty of working with kids, and that's a really good one to do that. And then the DSM-5 Made Easy, the Clinician's Guide to Diagnosis. It's a little older. It's from 2014, so it's 10 years old now, but it's so easy peasy to read and really shows you what you need to do in terms of diagnosing, that I think it's a really good resource to have on your shelf as well. And then there's a whole bunch of recommended texts here. So depending on how interested you are in each subject and how much you want to dig into each subject, this course is an overview. But if you want to dig more into any of this stuff, here are the texts that are recommended for you to do that. And then there'll be additional readings on Blackboard, and they're all listed here. So you don't have to go look for these, but I try to pick literature that is relevant, that is easy to read, that has definitely come out within the last 10 years. So anything that you see is definitely something that I have read and vetted. I'm never going to make you read anything for the sake of reading it. So all of the articles are here. There might be a couple more as we move through the semester and I update things that I put on there. But just know everything that you need will be linked onto Blackboard. Grading policy, same as pre-prac, a C or below at Warner is considered a failing grade. This course, my grading policy really comes in handy, especially with the case conceptualizations. As long as you get it to me before the due date, I will look it over and make sure that you are on the right track and doing the right thing. And then you can always go back and redo assignments as well. But in this class, I really want you to learn how to diagnose. So please feel free to send it to me ahead of time, shoot me a text, let me know it's in my inbox and I'll turn it right back around for you. Title IX, our Title IX officer. Oh, here it says Brian Brent. And the other one, it said Carol St. George. I'm sure that you can go to either one of these lovely people if you need anything in terms of Title IX. If you need an accommodation, we are happy to provide that to you. Please just contact Mary Judge. Her email is right on here. She's lovely, lovely, lovely. And if you need anything, then we'll be happy to do that. Online etiquette, anti-discrimination, and harassment policy. We will be conversing with each other through discussion boards in this course. And then there might be some videos, and then we'll definitely be on Zooms together looking at our case conceptualizations. So just remembering that everybody is a learner, all questions are welcome. We'll just work through anything that we need to work through with respect for each other and the clients that we serve. Academic integrity. Again, you know, Chat GPT is something that I love and use a lot. And the Warner School is in the process of formulating their policies around AI. I think it's great as a thought partner. Definitely don't have to do the work for you because there's not going to be any AI sitting in your counseling sessions with you in a person. But if we want to explore how to use AI as a thought partner, I'm totally open to that. All right, library services. The library is awesome. It has it's just, you can get resources from all over the world. So please take advantage of the library while you are here. You can log in and get anything that you need to get. All right, so course description. Again, you have 2 weeks to complete all of the work in each module. In each module, you will find you can earn up to 100 points. So you don't have to worry about counting your points. Your grades will be right on Blackboard for you. But there's 2 discussion questions, 2 discussion comments. So those are worth 25 points apiece. Discussion questions and responses and comments need to be comprehensive. They need to have substance. They need to have, a lot of them need to have references in there, APA style evidence, right? These are really things that you need to think about and answer comprehensively for each other. There's the weekly case conceptualization. Those are worth 30 points apiece. You won't do one until week through module 3, and we'll do that first one together. So everybody gets a 30 out of 30, but those are your most important assignments, I would say, in the course are your weekly case conceptualizations. You'll have learning checks every week, which is like a journal activity. So what are you learning? What do you need? How can we help you to get what you need? So your weekly course deliverables are $700. I wish I could give you $700. 700 points. And then there's a project at the end, which is worth 300 points. So this kind of breaks down what your assignments are, and they're in each module. They're very easy to find. So 2 discussion questions and 2 responses for each module. You'll have a learning check at the end of each module. You'll have your case conceptualization. And then at the end, you'll do a clinical assessment and treatment plan. So at the end, you will pick between a case about a kid or a case about an adult, whichever one you feel more comfortable with. And you're going to complete a comprehensive clinical assessment of a client, similar to the format of the National New York State licensing exam. So we try to show you a little bit what the exam will be like throughout the length of your program. So when you get to exam time, you can be like, oh, this is so easy, it's nothing. So for your clinical assessment and treatment plan, you're going to create a treatment plan with short-term and long-term goals, evidence-based interventions, cultural considerations, options for psychopharmacology. You're also going to create one alternative treatment modality based on your preference. So when we talk about evidence-based treatments, we're talking about things like CBT, DBT. You'll learn a lot about evidence-based treatments through this course, but also a lot of other things work too. So things like mindfulness, art therapy, sand tray, yoga, like anything that you might think is a great alternative treatment, I'm interested in that as well. And your final, you'll present the treatment via a video on Blackboard to share with the class. So just know that that's coming. It'll be due probably around December 5th. There's checkpoints all through the semester for you to think about that assignment. But that's going to be your big one at the end of the semester. And then here are all your K-CREP standards and your outcomes that measure each one of those standards. They're also on Blackboard. I think that might be the end. So that's the end. So if you have any questions about problem ID 1, reach out, text is best, and I'm here to help. Thank you.